And Dr. Quinn, we're talking about the dangers of warning signs. What are some of the biggest warning signs that people tend to ignore?
Well, the deal is what we want to express is we don't want anyone to ignore any warning signs because that's basically our body letting us know that something is probably not right. There have been some cases where patients have called the clinic and they were being responsible and they let us know that they were suffering from a warning sign called chest pain or shortness of breath. What happens is the nurse, she'll go get the medical provider and then we'll get on the phone and ask them more questions. And if the suspicion is true, then we'll have them go to the emergency room. We don't advise them to drive. And there have been cases where a person was having a heart attack or another very serious problem called a pulmonary embolism, but that person went to the emergency room on time and they were treated and they were later told that their life was saved.
So do men maybe ignore warning signs a little bit more?
We do. We're terrible about that. The bottom line is we're encouraging all our men to understand that we're just mortal. We're not Superman. We need to let our medical providers know what's going on. If we have fatigue, tiredness, or problems urinating, or even with intimacy with our wives, let them know. Because in a lot of cases, there could be something underlying that's undiagnosed and it could be treated and all those problems can go away.
Yeah, and is there specific warning signs that maybe people do ignore more than others? Is it maybe that they have a lump somewhere? You talk about that shortness of breath. Is it fatigue? Hey, well, I'm just fatigued because I'm working a lot. But well, maybe it is something else. Is there maybe one or two different warning signs that we tend to ignore a little bit more?
Yes, and I'm so glad you said a lump somewhere. I've had a lot of ladies over the years that have told me that, you know, I've done a breast exam and I felt a lump in their breast. And they said, I felt that for a while and I never said anything because I didn't want it to be anything. But what I explained to those women, you want to say something. You want us to know early because most problems like cancer, which the particular lady I'm thinking about had, we were able to get her with a surgeon and it was removed early before it spread. So warning signs, let your medical provider know, and then we can provide help. In a lot of cases, it can save your life.
This might sound a little funny and maybe might not make some sense. Is there ever some people that maybe have gone overboard on the warning signs? Like, okay, they start creating stuff. I know that may sound funny, but it's like, okay, well, that's a warning sign. This is a warning sign. This is just, okay, you are just tired.
These are my patients that go to Dr. Google. They get on the internet and they look for all this stuff and they say, Dr. Quinn, I'm dying because I have this. And they'll bring me all these papers and I'll read through them. But reassurance in a lot of cases, but we don't ignore anything in the medical practice. We follow up everything and we do the testing. And there have been times when patients have helped us to diagnose things that were undiagnosed and it did result in them having their life saved. So don't hold back. Let your doctor know everything. Let us know because we want to be there for you. And the more we know, the better we can serve you.
Is there any way at home to know that it is a warning sign? Because there are times you may just not even know.
Well, if it don't feel right, it might not be right. Let your medical provider know anything that's just abnormal about you. Hey, I'm feeling a little tired, I'm feeling a little dizzy, maybe my chest, my heart beats fast sometimes, just anything. Let us know because we want to help you.